Doctors are always seeking new and better ways to treat their patients for better health care. But more recently, with all the changes going on in the medical industry, we are finding that doctors are looking for and needing new ways to increase their bottom line. We have been substantially increasing the bottom line for doctors, anywhere from $30,000 to $70,000 a month and even more. Yes, you heard right, $30,000 to $70,000 a month, not per year, but per month. And doctors, you can do this without changing the way you treat your patients, nor having to increase patient load, and no investing in equipment or devices. We're all aware that the large hospitals and large medical corporations have been able to take advantage of all the ancillary services of the medical industry, such as labs, pharmacies, and testing centers. They have their own labs, their own pharmacies, and access to major discounts of medical supplies due to their large buying power. These additional services are a substantial income that independent doctors do not have access to and are completely missing out on these substantial earnings. By being part of our health management group, you remain independent and you can now have immediate access to all those advantages and substantial added revenues that the large hospitals and medical groups enjoy. Again, without increasing patient load or changing the way you treat your patients. This is why you see these large groups and hospitals recruiting and employing doctors and even buying up private practices so that they can gain the huge profits from these ancillary services. The reason you can now begin earning from these ancillaries is the way our HCM is set up and managed to fully comply with all the regulations and protocols, including being in full compliance with Stark laws, because we also have helped legislate the program. We have been successfully operating for 17 years with over 2,000 participating offices and tens of thousands of doctors nationwide who have enjoyed substantial earnings. By being part of this group, it's like having access to all the advantages that the big hospital groups have, including having access to supplies and equipment at substantial savings, and getting access to the cutting-edge testing models and much more. Additionally, with the changing and increasing new regulations and requirements from everything to mandatory protocols to insurance reimbursements to the ever-changing Medicare requirements, your practice can benefit from our medical group. We will guide you through and help you set up the safeguards that will keep your practice in full compliance. Most importantly, our member doctors are taking full advantage of the additional ancillary revenues and getting $30,000 to $70,000 a month, and in some cases even more. You will now have the same advantage that the large medical groups have. So take the next step and request more detailed information that will put your practice to work for you.